Physiowebseries Shoulder Complex Season 2 Series 4. So in series 3, in previous series we discussed about two muscles, serratus anterior as well as pectoralis minor. Now we will discuss about thoracohumeral muscles in series 4. Thoracohumeral muscle involves pectoralis major, which connects the thorax to the humerus. So the origin and insertion of pectoralis major, let's have a look at it. So can be appreciated in both of those diagrams. So let's focus on this first one. So the origin of pectoralis major is in two parts, the clavicular head as well as the sternal head. So from the clavicle it will arise from anterior surface of medial 2/3 of clavicle, which is the clavicular head, and the rest of the portion so can be well appreciated now. This is the clavicular head. From medial clavicle this muscle is arising, and the rest will be this sternal head, sternocostal head. From the manubrium as well as the sternum, 2nd to 6th costal cartilages it will arise, as well as from the aponeurosis of external oblique muscle. So medial 2/3 of clavicle, then half the breadth of the manubrium as well as sternum up to 6th costal cartilages, as well as aponeurosis of external oblique muscle of abdomen. From here it will insert to humerus at the bicipital groove of humerus. To be very specific, it is inserted to lateral lip of bicipital groove of humerus. Similarly, in this diagram also can be appreciated origin from clavicle as well as manubrium and sternum up to 6th costal cartilage, inserted to lateral lip of bicipital groove of humerus. So there is clavicular head and sternocostal head. This was about the origin as well as insertion. So we can understand the line of action. It is inserted over here and originating from here. So this way is the line of action of both the fibers, clavicular, both the heads, clavicular as well as sternocostal head. Moving on to nerve supply of pectoralis major muscle, which is medial and lateral pectoral nerve. So we can appreciate that upper fibers are being supplied by lateral pectoral nerve. To remember over here, the upper fibers are supplied by lateral pectoral nerve and the lower fibers by the both the nerves, lateral as well as medial pectoral nerve. So nerve to upper fibers is lateral pectoral nerve, C5, C6, C7 nerve root, and to lower fibers will be lateral as well as medial pectoral nerve, C6 to C8 and T1 nerve root. Now as we know the line of action, as it is attached in this manner to the lateral lip of bicipital groove, and over here originating from clavicle and manubrium as well as sternum. So this will act on shoulder or humerus. It is inserted to humerus, lateral lip of bicipital groove. So it will act on shoulder. So it will cause adduction of shoulder joint as well as medial rotation of shoulder joint. So adduction and medial rotation, as the line of action of muscle is this way. So when the muscle will pull it this way, both the heads, depending on those fibers, it will cause adduction as well as medial rotation of shoulder joint. Mainly if we divide according to the heads, the action of this muscle, the clavicular head will cause shoulder flexion. So the clavicular head will cause shoulder flexion, as the line of action of this is bit this way upwards. So this will cause shoulder flexion. Then what about the sternocostal part? That will cause extension of that flexed shoulder joint. So once this is in flexion, then the extension will be caused by those fibers slightly oriented this way. So it will cause extension of that flexed arm. Also, it is accessory muscle during inspiration whenever the shoulder joint is fixed in abduction. So it will act as inspiratory muscle, accessory inspiratory muscle. That was about the nerve supply as well as action. Now to remember a fact of pectoralis major as well as the minor muscle. So pectoralis major along with pectoralis minor is a major climbing muscle. So this will assist in pulling the trunk towards the humerus, towards the fixed humerus. So if the humerus is fixed at a point, that is, if an individual is hanging, this position or this activity can be assumed. If an individual is hanging through his hands, so the humerus will be fixed in this position, and here the pectoralis major along with minor muscle will assist in pull-up motion, that is pulling the trunk towards the fixed humerus. So it is a major climbing muscle, that is the pull-up motion, which is to pull the trunk towards the fixed humerus. Now a simple clinical aspect associated with pectoralis major. So here is pectoralis major contractural test, or to test the tightness of pectoralis major. So as we can appreciate in the diagram, the patient is in supine lying position and patient clasps the hands together behind the head. So now what the therapist does? Therapist will lower the arms until those elbows are reaching to the table downwards. Now if the elbows are not reaching to the table smoothly, then this will indicate a positive test or tightness of pectoralis major muscle. So this is about the clinical aspect, the pectoralis major contracture test. Can refer it in Maggie book for orthopedic physical assessment. So in this session we completed one muscle, which is thoracohumeral muscle, which is pectoralis major.